Good evening, ladies and gentlemen. It's my pleasure to welcome you to an exclusive webinar on dry eyes and important tips on eye care, hosted in collaboration with Zamindar's Microsurgical Eye Center. Before we begin, I would like to tell you about our organization, Via Vikas, a registered trust with a dream to build and strengthen an ecosystem for seniors that empowers the seniors to lead a productive and meaningful life. We are a community of senior citizens member enabled through an online platform with a focus on wide range of services starting with legal, financial, health and wellness. I now take privilege of introducing our speaker. Our distinguished speaker for this webinar is Dr. Soumya Basant, a highly esteemed cornea specialist at Zamindar Microsurgical Eye Center. Dr. Basant brings over 6 years of dedicated experience in the field of prestigious Regional Institute of Ophthalmology, obtained a fellowship from the prestigious Regional Institute of Ophthalmology at Bangalore Medical College, and has made numerous presentations at both national and state conferences. Dr. Basant has a profound interest in the field of dry eyes, and her expertise and insights will be invaluable to all attendees. In this webinar, you will increase your awareness about dry eyes, learn about its causes, symptoms, and treatment, and get practical tips for managing various eye conditions. If you have any questions during this webinar, please type them in the chat box. Dr. Basant will answer them after the presentation. We hope you enjoy this webinar and find it an enlightening and educational experience for all participants. We look forward to your present and active participation in this significant event. Thank you and welcome once again. Over to you, Dr. Soumya Basant.
Introduction. Am I audible?
Yes.
Thank you for the introduction. At the outset, I would like to thank Vaya Vikas for giving me an opportunity to talk about dry eyes in senior citizens and plus various other numerous eye conditions which probably could be of immense help to them, how to recognize and when to seek medical advice. Okay, and shall I start sharing my screen? Yeah, the whole purpose of doing this talk was to create more awareness about dry eyes, which is a very common condition, probably goes unrecognized, and a lot of people and all, most of us above 50 years can, have some symptoms of dry eyes. How to recognize these symptoms and what is its importance, especially in senior citizens, that is my whole focus of this talk. Some of the myths and facts about eye care. Our eyes are the window to the outside world and it connects the life in all its vibrant colors. There are various myths and misconceptions associated with eye care. I'll go one by one. Myth number one, I think most of us, you've heard people asking, eating carrots alone can it improve vision? We've at various times have had parents coming in and asking, especially more than the elderly, when they're accompanying a small child, they're like, if I give carrots or similar things, papayas or green leafy vegetables, will it improve vision? No. Though carrots contain an important vitamin precursor, that is the beta carotene, which is important for eye health, per se, it does not have any role in bringing down the spectacle number, or it does not change the vision. Of course, it's important for the functioning of the eye as well as various organs, but per se, it does not change the refraction, or the power does not come down with eating, just with having good food or eating carrots. A healthy, well-balanced diet, which includes various foods which are rich in essential nutrients and all kinds of vitamins A, C, E, and minerals like zinc and lutein is recommended, though it does not have a major impact in reducing your vision or your spectacle number. And I have at times, various elderly population coming to me and asking when I say they have a cataract, does eating any kinds of food or, modifying my dietary supplements, will it alter? No, the answer is no, it will not change. Cataract is an aging process. It happens with or without, intake of any nutrition. It is just the opacification of the lens, which is indigenous of your dietary intake. The second myth is staring at screen ruins your eyes. This is probably, a lot of more than the elderly population. I mean, anywhere between 20 to 45, all of them are using computers, depending on the number of hours per day. It could be varied. uh, Many people feel, staring at the screens for a long time can ruin their eyesight. That is not right. It does not ruin your eyesight, but definitely there's a digital eye strain which causes eye strain, which transforms into a headache. This is called computer vision syndrome. They can have varied symptoms like dryness, which I've mentioned here, redness, blurred vision, headaches, very often headaches. We've had various, patients coming into our clinic saying, after staring at the screen, towards the end of the day, they develop a headache, eye ache, discomfort to watch the screens, or blurred vision where they have to frequently, rub their eyes to see the screen clearly. What are the tips to reduce the screen related eye strain, which is, I think, I should focus more on? Follow this 20-20-20 rule. What do we mean by 20-20 rule? Every 20 minutes, take a break for 20 seconds and look at a distant object which is 20 feet away. This is the popular thing, nomogram, you would have seen at any optometrist or even optical shops displaying this 20-20 rule. It's a very simple thing. Every 20 minutes, take a break for 20 seconds and look at a distant object. That is, take your eyes off the screen or the monitor and look at a distant object which is at least 20 feet away. This helps the eyes relax its eye muscles, which are in constant, contraction when we're looking at screens which are placed at about 80 centimeters. Blink more frequently. What happens whenever we look at these monitors? These are called visual display units. It could be your mobiles, it could be your television, it could be your tablets, it could be your computers, laptops, desktops, whatever. What happens is whenever we look at any of these visual display units, most of the times we do not blink that often. Blink is an involuntary natural reflex which happens about 12 to 16 times per minute in an adult, which does not happen when we're looking at any of these screens. So, per se, what happens is the tear film, which is on the ocular surface, remains for a longer time, uh, and it causes dryness because there's more evaporation. So, by blinking frequently, the tear film gets resurfaced on the ocular surface every minute. Optimize the screen settings, adjust the screen brightness. I've had patients coming in and saying, especially the young crowd, they keep the brightness to zero, thinking that it will cause strain. No, that is not the right thing to do. Adjust the screen brightness and contrast and font size to ensure comfortable viewing. Avoid glare or reflections on your screen. Suppose you're sitting close to the window, your system or your display screen has to be perpendicular to the window. If this is the window, okay, and it has to be perpendicular to that. Okay, not parallel, because the light coming from the window can fall on the screen and cause glare and cause discomfort. Maintain proper screen distance. What do we mean by maintain proper screen distances? We always tell our patients, when you're working even from home, nowadays they have this hybrid culture. They work from home as well as go to office or totally work from home. What happens working from home? We keep the laptops at everywhere and anywhere, in the living room, on the sofas. We sit and work there, but that's not the ideal situation. Always use your laptops or desktops sitting on a chair and a table. Access it only sitting on a chair and a table. Why? Because your hands are parallelly rested and your feet is parallel to the ground, and there's no strain on the neck muscles when your hands are comfortably rested. And make sure the viewing distance is exactly at your extended one arm's distance. The monitor or the screen should be at your extended one arm's distance. That is the ideal way. See, all of us, our height differs, even our arm lengths also differ. So you always adjust your screen according to your extended one arm's distance. That is an ideal way to position your screens. Use blue light filters. Most of the advanced machines have an inbuilt blue light screen. Sometimes you can use blue cut lenses with a zero power when you're using the screens for more than 4 to 5 hours, maybe continuously or contiguously, in cumulative hours. Stay hydrated, drink plenty of water to keep yourself hydrated. You can consider computer glasses. These have an anti-reflective coating. which reduces the glare which comes out from all these screens. And regular eye exams, scheduled regular eye exams with the optometrist or an ophthalmologist to detect or address any vision issues. Take proper breaks, especially, if we are not able to do every 20 minutes for 20 seconds, take a break at least, remember every 1 hour for 5 minutes. The major thing we have to focus on, take your eyes off the monitor, look at a distant object, preferably out of the window, which is 20 feet away. The third myth is most of them feel eye examinations are only for those who have poor or bad vision. That is not true. This is the whole, importance of putting up the slide is trying to highlight the importance of regular eye exams in everybody. A common misconception is that eye exams are solely necessary for individuals with poor vision or noticeable eye problems. That is not the case. They definitely need, and all of us need, and I'll tell you when or whom need, which category of people need, regular examinations. Eye exams are crucial aspect of maintaining an overall health regardless of their current vision status. All patients, what we do at our center is any patient above 40 years, it's a no norm that we follow. We dilate them. Dilate is put the drops, take a look at their retina. It's a routine examination so we can detect. One is it screens for glaucoma. Plus, if they are diabetic or a non-diabetic, still we can look at the rest of the retina and take a look at the blood vessels and the optic nerve head. Additionally, they can uncover any underlying health issues just beyond any vision. Patients sometimes do visit us not knowing they have a vision problem. Sometimes people have walked into my clinic saying they have giddiness. When I've examined them, I have picked up few signs and then referred them to a neurologist. Sometimes they come with headaches, chronic headaches which doesn't decrease. They visit an ophthalmologist sometimes, not always, and when sometimes we detect, and I have sent them to a neurologist. I had a kid about some 6 years back who came with a recent onset of nystagmus. Nystagmus is involuntary movements of your eyeballs, and this was a recent onset history. The mother came with a 6-year-old girl, and when I examined, there were certain signs which was not consistent with a regular or a infantile nystagmus. Then I referred her to the neurologist because they couldn't, somehow go to a private care. They were referred to NIMHANS, and there the child underwent a surgery. So that, I mean, timely intervention or the first caregiver, the parents, or somebody close to even the elderly people should bring them to an ophthalmologist if they have some issues, so we can, maybe not always address those problems, but yeah, at least proper referral to a neurologist or a physician will be done. Conditions like diabetes and hypertension, autoimmune disorders. If you've heard of autoimmune disorders, encompass diseases like rheumatoid arthritis, Wegener's granulomatosis, systemic lupus erythematosus. All these diseases can have ocular manifestations. People sometimes might not be aware. They can be on drugs like chloroquine, HCQS, methotrexate, and all that for rheumatoid arthritis for for n number of years. But they forget that these kind of diseases have an ocular manifestation. It is they have symptoms of severe dry eyes. Rheumatoid arthritis is associated with severe dry eyes, and they have to visit an ophthalmologist to treat their eye conditions adequately. Encouraging proactive eye care, schedule regular eye exams. Diabetics, we always tell them, even their diabetes levels or blood sugar levels are well controlled, we still tell them, ophthalmic examination or an eye examination is mandatory every year. We just examine them, certify that everything is good, and the patient is happy, the doctor is happy. But the checkup is mandatory. And any other history, family history of glaucoma becomes very important in first degree relatives like your parents and your siblings. We tell them, maybe they are not in our vicinity, but we tell impart the education is given to the patient whenever a patient comes to us with glaucoma. We tell them, tell all your siblings to get themselves checked by an ophthalmologist in whichever part of the country they are. It becomes very important. If you do not visit an ophthalmologist, all this knowledge, maybe you cannot get it from the internet. Coming to cataracts, which is, affects people above 40 years, more so above 60, but yeah, lesser than 40, lesser than 60, or also, I mean, we do early cataracts nowadays. It's one of the leading causes of treatable blindness. Most of the blindness, all blindness cannot be treated, completely, but cataract is one thing which is the leading cause of blindness, can be, I mean, completely cured. More than 20 million people developing this disease. Typically, they have no symptoms until they have problem with their vision. That is when they come to us. Cataracts, when their people experience diminution of vision for distant objects, that is when they visit an ophthalmologist. Then we do a dilated examination and tell them that they have cataract. The fifth myth is prescription glasses not to be worn at all times. If you have glasses which has been prescribed by any doctor, please make sure you wear it, because it ensures better vision and it reduces the risk of falls and accidents, because your vision with the glasses, the clarity of vision is better with the glasses. And especially in elderly people, it becomes very important to prevent falls and accidents, because the vision is crisper and better when they wear glasses. So if you have elderly people at home, please, if they have a prescription glass, tell them to wear it. It is better for them, so that you can prevent untowards complications. Systemic diseases, as I've discussed earlier, like diabetes, hypertension, atherosclerosis, is nothing but increased cholesterol levels in your blood, which the atherosclerotic plaques get deposited in your arteries. It's a cardiovascular disease. People think just because they have all this, they are not aware of the fact that they can have implications in the eye, and they have to visit the eye doctor also. That is a myth, and people have to remember, all people with hypertension, diabetes, or even increased cholesterol levels have to have regular eye checkups. Because if they do not, they can lead to detrimental loss of vision because of the adverse changes which happen in the blood vessels, which are present even in the eye. Some of the eye diseases with vision threatening complications. Here, majorly, I'll discuss glaucoma, age related macular degeneration, and diabetic retinopathy, which is important in elderly people. I'll go one by one. Glaucoma is called the silent thief of vision. The patient never comes to the ophthalmology OPD saying that they have glaucoma. Glaucoma is just, picked up by the ophthalmologist when we do our routine screening examinations. That is why it is very important. That's why we screen all patients above 40 years of age for glaucoma. Glaucoma, the patient, the central vision is preserved till the end. The only thing is, if the patient is sensitive, they'll have a loss of field loss. Field is when I'm looking straight ahead, I know there is, I have some few books here, there's a window to my left. This is my field of vision. What happens in glaucoma is there's a constriction of my field of vision. The patient has to be very sensitive to know this. Otherwise, they will never report to an ophthalmologist. Even if they report, the problem is, once the damage is done, it cannot be recovered. Whatever the damages are done, it is permanent. So prevention is better. That's why we always screen the patients for glaucoma. We look at the eye pressures, we look at the gonioscopy, and that is the outflow where the fluid, exit pathway, we look at it, plus the retina examination where we look at the optic nerve head. And always everything is documented in our system. We have a medical record, we have an electronic medical recording system where it is documented. Even if the patient loses record, they have to just give the phone numbers. It's all preserved here. We have records going up to even 2000 also. We are in 2024. I've had patients who have had records from 2000 also. Then we have another entity called age-related macular degeneration. The only symptom the patient will have in the later stages is loss of vision. That is when we can, this is more common in patients in the Western world rather than in the Eastern world. But still, it's not that we are We don't see cases of age-related macular degeneration. It is also there. It's more common in the Western population. There are two categories, dry AMD and wet AMD. Here we call it as few changes which happens in the retina. There are few deposits which happen in the retina, or the nerve layer has 10 layers. In that, in one layer gets affected, and in that, that's a central layer which gets affected, and that's how it impacts the vision. Even here, the vision loss will be permanent. So it is always, whenever we do these screening tests, we can pick up all these things and adequately we can treat them. Next is the diabetic retinopathy. Diabetic retinopathy is a condition which is associated with diabetes. Not all diabetics will have diabetic retinopathy. When the sugar levels are uncontrolled for prolonged periods of time, they can have diabetic retinopathy. But the best part about this is, if your sugar levels are well controlled for the next 1 or 2 years, all these changes are reversible. That's the only condition which is slightly better off, where all the changes which have happened can be reversed. Coming to dry eyes, what do we perceive by saying dry eyes? It's a common condition that occurs when your tears are not able to provide adequate lubrication of your eyes. The tear ocular surface is bathed by externally by the tear film. So it protects that. It acts like a lubricant. Every time we blink and open our eyes, it is like a windshield wiper mechanism. It's like, water, rainwater on the windshield. And when you run your wiper, this is the same effect the eyelids have on the ocular surface. Tears can be inadequate or unstable. Dry eyes may occur when there is not enough tears. That is, there's a decreased quantity of production, or there's poor quality tears. I mean, there is more inflammatory markers in your tears, which causes irritation to the eye. This leads to the instability or inflammation, and what happens? The end product is damage to the ocular surface. These are the symptoms what the patients can present. There are varied symptoms. Each patient can have one or multiple symptoms, or they can just come with a single symptom. Dry eyes can affect any population between, even children, because of increased usage of computers nowadays, which leads to something called as evaporative dry eye, and more so in the elderly population, because whatever the glands, as there are changes, aging changes in the body, even these glands, they undergo atrophy, which are present in the lids, which secrete a component which is a part of the tear film. What are the symptoms of dry eyes? They can come with redness, stinging, burning, blurred vision. Frequently, they have to blink, clear their vision. Sensitivity to dry light, that is when they go to the sunlight, they're not able to open their eyes, they forcefully close their lids or keep it partially open like this. Excessive tearing, foreign body sensation. What do we feel by this is, today also I had a patient who said, constantly at the corner of my eye, I have a feeling as if there is something. There'll be nothing. This is a foreign body sensation because of dryness. They feel they have some sand or gravel feeling inside the eye, or foreign body sensation. Itching, they feel like rubbing their eyes constantly. And eyelid asymmetry is whenever there is chronic dry eye, they try to shut off the light by, just, squinting their eyes like this. They can come with any of these symptoms. How do we, what are the causes of dry eyes? Reasons for a tear film dysfunction may include any hormone changes. All women above, in the perimenopausal or postmenopausal age group, the tear or the ocular surface is very sensitive to estrogen and progesterone. There are receptors. So postmenopause, a lot of women compared to men experience dry eyes. And autoimmune disorders, as I've already stated about rheumatoid arthritis or systemic lupus erythematosus or Wegener's granulomatosis, these are autoimmune disorders. Commonly, all of you would have heard about rheumatoid arthritis. They are associated with dry eyes, inflamed lid glands, or chronic allergic eye disease. More so seen in very young kids. You can see them chronically rubbing their eyes. A part of allergies can cause dry eyes, or the antihistamines which we use to treat allergies can per se cause dry eyes. There is decreased tear production. What happens post chemotherapy patients or radiotherapy, when they have received radiotherapy to this head and neck region, they can have, these lacrimal glands which secrete the tears. can undergo changes and decrease them. There's a decreased production of the tears. Or all these computer users, what happens is they also experience dry eye because there is increased tear evaporation because they don't blink that often, so it doesn't get resurfaced. So there is increased evaporation of the tears causing dry eyes. The mechanism, whatever is the mechanism, still both of them feel all these symptoms, what I've said in my previous slide. What are the prevention strategies which you can employ at your level so that you can to a certain extent avoid or prevent dry eyes? Avoid air blowing into your eyes. Whenever you're a computer user, you're in your office, don't sit opposite to the blowers, AC blowers or heaters. Even in the cars, do not direct the vents directly towards your face or the eyes. That way, you can avoid air blowing directly into the eyes. Add moisture to the air. In winter, humidifiers can add moisture to indoor air, but here, not so much. We don't use heaters down south. Consider wearing a wraparound sunglasses or other protective eyewear. If somebody has undergone a cataract surgery, you can see the cataract glasses are slightly different from the regular glasses. They have a protective this thing shield, which covers this temporal part of your eye also, so that it retains more. If you wear these glasses, then your eye is not exposed to wind and other environmental changes. So you can preserve your natural tears. Be aware of your environment, especially if you're in high altitudes, in desert areas, or in aeroplanes. You've experienced this, I think, probably traveling in an airplane. You will feel, extremely dry. Even dry mouth is also very common when spending time in such environment. It might be helpful by frequently closing your eyes and trying to blink more often to minimize the evaporation. Position your computer screens below your eye level. One of the 2020 rules what we follow and positioning your screens is whenever we look straight ahead, this is called my horizontal view. Position your screens just below your eye level. See, this is my horizontal eye level. Position your screens below it. So what happens? We gaze down like this. So the area available for evaporation of tears is lessened. If it is straight ahead like this, if I'm looking ahead, the surface area of my eye, the availability for evaporation of tears is more. So by keeping the screen down and when we look down, you decrease the area for evaporation. This is what is to be done whenever you have to position your screens. Always, this is my horizontal eye position, slightly below it. The ideal position would be 8 to 10 inches below your horizontal eye position. If all this doesn't work, you still persistently feel all the symptoms, burning, tearing, irritation, photosensitivity. That is, whenever you go outdoors, you have difficulty opening your eyes. Please seek medical attention. Otherwise, the symptoms could, lead to other problems, and even your vision can, deteriorate over time if your dry eyes has gone to a severe grading. Any patient comes with dry eyes to our clinic, we have various in-house tests and a few investigations. They're all non-invasive. What we do, and then we classify the type of dry eyes, and accordingly we give treatment. This is one of the state-of-art methodology of treatment of dry eyes that I have in my center. Very, very few centers in Bangalore have it. Very few centers in Bangalore have it. And I feel proud that we are having it at our center. This is one of the ways we can target or stimulate the glands to produce better quality components called sebum, which is a part of the tear film. It's a topmost layer. It is called the lipid layer or the oily layer. The whole function of this layer, tear film, has three layers. The top one is called the oily layer. It is like spilling a layer of oil on a surface of water. It retards evaporation. The similar function is done by what we have depicted here by these glands. So by using this methodology, it's called IRPL technology, intense regulated pulse light therapy, which is given. It is done in 3 settings. It has to be done in a clinic itself. It's a 10 minutes procedure. It does not have any side effects, can be done to any patients. This patient you're seeing, this was a post-cataract surgery patient who was about an elderly gentleman that I've been doing a IRPL therapy. Yeah, this is in brief about dry eyes and a few eye conditions which I've touched upon, which is important in senior citizens. Any questions, I'll be more than happy to take.
Hello, Doc. Is use of refreshed tears recommended as a preventive?
Oh, no, sir. What happens is, see, whenever people buy over-the-counter medication, the problem with the eye drops is you have to use it once the lid is opened, it has to be used within 1 month. That they have to be aware. Otherwise, you'll have to discard it. 1 to 1.5 months is the ideal time. It's not like the tablets, whether if you turn to the back of the label, it says 2025, you've utilized, there's a strip of 10 tablets, you can still use it. It's not the same with the eye drops. That everybody has to remember. Once opened, the external air gets in, you don't know what is happening inside the opaque bottles. You cannot use it beyond 1 month. So whenever patients come to us, we always give them a period and then stop. And everybody doesn't have to use it. Not every patient will land up with dry eyes. So there's no, I mean, as a preventive strategy, there's no need to use these lubricants.
Thank you.
Which one?
Stop sharing.
Doctor, is
Any
it bad to
questions?
splash water on your
No, no, that's
eyes?
again a myth. No.
Is it bad to splash
Water, I'll tell you what happens. A lot of us do, a lot of Indians are into the
water?
practice of waking up in the morning, we splash water. What happens when we splash water is, whenever anything comes close to your eye, it's a blink mechanism and your eye closes. There's no added advantage by splashing water. If you have allergy or ocular irritation, what you have to do is dip a clean handkerchief in cold water and place it on your eye like this. By splashing water will not have any effect on the eye. Or you take few ice cubes in a hanky, and keep it on your eye. That's how we go about it. If at all you need cold compress or there's irritation, whenever you've gone out, you feel itchy or irritated, this is what we do. By splashing water, it will not do anything.
Okay, thank you.
Good
Doctor,
evening, doctor. Good evening, doctor.
Good evening. Good evening. Good evening. Yeah.
Yeah. I having dry eyes, and after giving some drops like Tizzy and some other tear drop,
Okay.
still I'm having pain in the eyes. It's now 6 months, but these drops are not helping me at all. I still have pain in my eyes. I'm sensitive to light, and that is sunlight. What is
Okay.
my next
No, ma'am. How old are you?
60?
Okay. Any other comorbid conditions? Are you a diabetic or hypertensive?
No,
Any
madam.
history of rheumatoid arthritis?
I have arthritis of the knee, but it is not diagnosed. But I still have some pain. But I have not got any reports to say that.
Okay. So, and you for the last 6 months, you've used the lubricants continuously?
Yes, I have used every day once.
No, once will not do anything. This is not a tablet, ma'am. The minimum required dosages of the lubricants is minimum is 4 times. Minimum, I'm saying.
Oh, okay.
If you have not used it that often, then it'll take a little longer.
Is
Once
it
will not,
curable? This
because it
pain?
remains on the ocular just for 5 minutes.
Oh, okay. So you want
Okay.
me to increase the number
Yes.
of times to use. But will the
Yes,
pain
yes.
go?
Pain, we have to see what is the reason for pain. Even if there is any strain or if you have any, refractive errors, that also has to be treated.
That refractive error is corrected, doctor. Now I'm having my spectacles and I'm very happy with that.
Okay.
So, but the
Then,
treatment that which you just spoke about, will that
yeah,
be
we
my
can do that.
treatment too?
We'll do a few evaluation. Yes, you can benefit. Yes.
Will
First, I'll
that
do a
treatment
few
help
evaluation.
patients like me?
Yeah, I've had about a lot of patients who have treated with IRPL fairly good.
And the results are positive and good.
Pretty okay. Yes, yes.
This pain will go away then.
No, I'll have to determine first, no, ma'am.
Okay,
Whether
thank you,
you're an
doctor.
ideal candidate. I mean, I cannot subject everybody to that treatment.
Okay,
There
that
are
is
few Yeah.
Yeah. So I
Criteria and
found
categories. If
suitable.
I evaluate, then I'll know what is the root cause. We'll have to treat the cause rather than, just by giving lubricants.
Okay, doctor. Thank
Namaste,
you very
madam.
much for this
Mr.
answer.
Prakash here. I have put two questions in the chat box. One is regarding holding the mobile as far as the
Yeah.
screen part is concerned in front of the eye. Second question I have asked is, no, I forgot. Anyway, see, my wife has a small problem with the eyes. She has very narrow rheumatoid arthritis, which started due to one of these diseases about 2-3 years back. Okay, she could overcome the arthritis problem to some extent by practicing yoga regularly. But however, of late, she gets a lot of pain in the eyes if she reads beyond, say, half an hour to 45 minutes. What could be the reason? Thank you.
Does she wear her glasses while reading?
Yeah, she has to necessarily, otherwise she can't read the letters.
Okay. The second thing is she has to sit in a bright room, whether it's in the morning or evening times or late into the night. If she has to sit in a bright room and use the, does she read on the books or does she read the Kindle or does she use the laptop?
No, I think you have made a very nice observation. I often tell her not to read while driving in the driving the car, that as a passenger, of course. Okay, she goes on reading even when the car doesn't have enough of
Yeah, she
illumination.
has to avoid that, sir. What will happen? I'll tell you why. Well, you should
Yeah.
tell your kids or any youngster also. What happens in a moving vehicle is it's in constant motion, right? Whenever we try and focus on an object or whatever the lines are, your eye focuses, refocuses because of the movement. And this causes a lot of strain. And young children can cause an increase in their spectacle number also. So that's not an ideal thing to do.
Regarding this very
In a moving car or any moving vehicle.
see, regarding the very small trace of rheumatoid arthritis, which she developed as a result of dengue fever, say 3-4 years
Okay.
back. See, her R factor is uh, other than, I mean, less than the normal, only to a marginal extent. Okay.
RA factor.
RA factor, it's very marginal.
Okay.
Just till 1 minute.
Mm.
And she has been given just hardly 1 or 2 pills per week. That's all. Okay. Because it is stable. It has not gone weak. I mean, it has not been downgraded as such. Okay. It is at constant level. So whether, since you mentioned about rheumatoid arthritis as one of the reasons for dry eyes, though this is not of dry eyes, whether that has any impact on.
It will have an impact, sir. I will tell you why. See,
Okay.
rheumatoid arthritis, because of your yoga and all, you have taken care of the joint pains, right? The underlying pathology is still there.
Ma'am, should I put that form here?
Can you hear me?
Yeah.
Yes. Yes, sir. So, I mean, we'll have to evaluate her, and if there is signs of dry eyes, and especially rheumatoid arthritis land up with severe dry eyes. So we'll have to, evaluate her for dry eyes and see if that is the cause, if she's wearing her glasses, that could be the cause for her pain while reading.
Can I speak?
Yes, Miss Samina.
Yeah. Yes, I'm 75 years old now, but I was diagnosed with glaucoma about 6 years ago. I was never ever sent for a field test or anything. I went to the same doctor all the time. And so there was already some damage to the optic nerve. But with Lomigan eye drops in the night, it has remained stable for the past 6 years, except sometimes when the pressure goes up beyond 20, she gives Primilol eye drops for just till it settles down.
Okay.
And for my dry eye, which appeared, my cataracts were very early in life, in the 50s. And 6 years later, I started that dry eye. So I was giving Gentle and Refresh eye drops, which has managed the thing. I don't have any other conditions, no diabetes or BP or any cholesterol or anything. So I mean, what?
Yes, ma'am. The first thing is you'll have to ask your children to get, if they're above 40 years,
Yeah.
to get their eyes checked.
Yeah, that is.
Okay, as a routine. And please ensure that if you don't have any family history, like your parents or anybody,
Parents
then you
did.
don't have to tell your siblings. Only your children, you please keep them informed about this. And the second thing is you have to get your IOP check, that is the intraocular pressure, every 3 months once.
Yeah.
And once we'll do the field test, we don't do it every year. We do it once in 2-3
2
years.
years. Yeah.
Please get that test done, because tomorrow if there's a progression, that's the only way I can keep a check on what is happening. One, we take a look at your disc, your pressures, and then your gonioscopy, that is the outflow outlet. How is it, whether it's narrow or open? And these are the few criteria, and the field test has to be done. It's called a HFA 30.
Yeah, I do that. I do that every 2 years.
Yeah.
In
Then
state.
if you're well controlled, yeah, we just keep you on follow-up, ma'am.
Yeah.
Mr. Bhagwantas, you can ask a question.
Hello, doctor. Hello, doctor.
Good evening, sir.
Actually, I'm 74. I have had this, whenever I go for a checkup, the doctors tell me the cataract is in the beginning stage. When is the
So-
ending stage?
Sir, it is echoing. I couldn't get your question.
No, because I'm on a double thing, because I'm not able to listen to you from the regular thing. So that is why
Thank you,
I'm
sir.
using this thing also.
Okay.
Now
Tell me,
you
sir,
are
what
able
was
to
the
hear me?
question? Yes, sir. Clearly.
Are you able to hear me now?
Yes, sir. I can hear you clearly. Please
Acha,
go ahead.
that's what I said. Whenever I go to an ophthalmologist, they say that I have got beginning stage of cataract. When is it
Yes,
going
sir.
to end, and how long I should wait?
See, whenever this is a question which I commonly face. See, whenever anybody comes to us above 50, traces of cataract will be there because it's an aging process. Like we have white hair. See, it is in the beginning of whatever, because I'm in my late 40s, it is there. It will definitely progress. Cataract is also like that. And if you don't have any other comorbid factors like diabetes, it doesn't progress that fast. So
I'm
there's
also
nothing called
diabetic.
as end stage. How we would evaluate a patient is whenever the cataract is, we grade cataracts. Okay, whenever it is central, it is affecting their routine activities. So if there is blurring of vision, some people complain of glares while night driving, or their contrast is decreased compared to the other eye. That is when, depending on their need, that is when we advocate cataract surgery. It is not like 40-50 years back when they used to wait till the cataracts used to become mature. That we do not wait at all nowadays. We will not wait because it will be associated with other complications. They can go into something called as phacomorphic or a phacolytic glaucoma. When we cannot promise better vision, when if the cataract per se, because of they were not able to reach an ophthalmologist, if it's gone into that stage, it will be when we will not promise any good vision with that kind of cataract. So we do not leave it until maturity. There's no end stage. We definitely don't, no ophthalmologist would leave it. It's the same norm followed worldwide. We'll not go reach until maturity, will not wait until then.
But
There are very
there are no complications. There are no complications on my vision.
No. Whenever you go for a routine checkup, we will always tell you how much based on your vision and your extent of cataract, whether it's progressed or not. Sometimes the progression is very, very slow. So, if you're able to manage and you get good vision with glasses, we will say continue the same glasses. When there's no, that is one of the criteria. One of the major criteria is the patient is not having good vision with the glasses and has a diagnosis of cataract. That is when we'll advocate a cataract surgery. That is a point of where we advocate cataract surgery.
Hello. Can I speak now? Can I speak now?
Yes. Hello. Yeah.
Yeah, I can hear,
No,
ma'am.
I am 72. I am using reading glass. Hello. Hello.
Hello. Yes, sir, we can hear you. Please go ahead.
No, I am 72. I am using reading glass.
Okay.
I want to get rid of the reading glass. Any suggestions are there? Can you give me any suggestions?
Sir, I
for
was
it?
not able to hear.
I am using reading glass. I am 72 now. I am using a reading glass. I want to
Yes,
get
sir.
rid
You're
of the
using
reading
reading
glass.
glasses. Is that correct?
Yeah. I want to
Yes,
get rid of
yes.
the reading glass. Any suggestions can you give me?
Ma'am, I didn't get the second part of the question now. If somebody
So he's
heard it,
using the reading glass. So is he?
yes.
He's asking, is there any way to get rid of?
You can get rid of, we have something called as this thing, what is that, laser surgeries, which is called presbyon, which can take care of the presbyopic numbers. That is the reading glasses. Or if he's due for a cataract surgery, we do different kinds of IOLs, multifocals it's called, where it takes care of your near vision also. There are two ways.
Without surgery, it's not possible. Without surgery, it is not possible.
Without surgery, no, sir. No.
Okay, thank you.
Thank you, sir. Thank you, Ms. Somya. That was an informative session. I'm sure all of you have gained valuable insights into the problem of dry eyes and tips for eye care. Heartfelt thanks to Dr. Somya Basan for lucidly throwing light on this important topic. We thank the management of Zamindar's Microsurgical Eye Center for organizing this webinar. I thank our energetic members for joining in and enthusiastically participating in the webinar. If you have any questions or would like to reach out to Dr. Somya, please do contact us at Via Vikas and we will connect you to her. Once again, thank you. And we have an announcement. We have an upcoming event for our Silver Star for the seniors. The Silver Star Talent Hunt is here, and we are excited to witness your incredible talents, whether you're a singer, dancer, or musician. This is your chance to step into the spotlight. How to participate? Register. Sign up for the Silver Star by visiting website or contacting our team. Create your audition video. Prepare a captivating 1 minute video showcasing your talent. Be creative and expressive and let your passion shine through. Submit your entry. Send your audition video to the designated platform. Remember, this opportunity is exclusively for Via Vikas member. Thank you very much. We would appreciate your valuable feedback on the webinar. Please fill out the form. Thank you once again and have a great evening. Thank you, ma'am.
Thank you so much for having me here. I mean, if they have any issues, any queries, they're all free to visit our center for any further evaluation or any kind of inputs they want. Apart from me, there are other specialists also. If they have any kind of eye conditions, even if they want to talk to us, all of us are available.
Yeah, thank you.
Thank you so much.
Thank you,
Yeah.
madam.
Thank
Thank
you.
you.
Thank you.
Thank you.